Hey, familia. Welcome to your healthy dose of spice. I am Dr. Alex, and today we're talking about non-alcoholic fatty liver disease. It's a mouthful, but it is a real life thing that so many people have. And the reason I'm talking about it today is because I literally got a text about it earlier this morning. A friend of mine messaged me and said that her friend, they were up Googling these lab results because her friend got labs drawn and they were abnormal. And she wanted to know what ALT and AST were. So let me make sure that that's what it was. Yeah, ALT, AST. So that's what we're going to be talking about. So these are lab results. These are liver function tests that you can get. And so if you're coming on, pop on, say hi. I'd love to give you a shout out. But we're talking about non-alcoholic fatty liver disease, what it is and why you need to be aware of it. And why I'm talking about it today, because somebody messaged me about this topic. So ALT, AST lab work, those are liver. That's a liver function panel that we're running. So we're looking at liver function. And so this person's liver enzymes were high. These labs were elevated. So why is this? So this is what happens when you get non-alcoholic fatty liver disease. And the reason it's called non-alcoholic is because your liver enzymes will be elevated. They're shown to be elevated. If you get a liver ultrasound, which is usually the next step, you will see damage to the liver. It looks like the liver of a person who is an alcoholic. So people who are alcoholics, who are drinkers, when we do their labs, their liver functions are off the charts. They are crazy high because their livers are so damaged from all the alcohol. Our livers filter all the blood, all the things in our body. They're a huge, important part of our bodies and how it functions. So we get these alcoholics who have crazy high liver function tests. But we also see it in patients who are overweight, who are obese, who are not very healthy. So these liver enzymes will be elevated. And in that case, if you're not an alcoholic, it is called non-alcoholic fatty liver disease. So what happens if we continue to allow our liver to get damaged? Well, something called jaundice happens, Jaundice. Go ahead and Google and look it up, because if you get to that point where you become jaundice, you will be probably about the color of my wall. You will become orangey colored. And you will have a huge, big old tummy. You'll get something called ascites, which is a bunch of fluid collecting in your abdominal area. And you'll have skinny little arms and skinny little legs. It will progress to jaundice. You'll have orange, kind of yellow colored in your eyeballs, in your sclera, they call it, the white part of your eye. Your mucous membranes will start to become discolored. These are all signs of jaundice, and jaundice is from liver damage from alcohol or non-alcoholic fatty liver disease. That can all progress to this, which, if left unchecked, will progress into you needing a liver transplant, to your liver failing. Okay, this is all real shit that I'm talking about. It can happen to you. So she said that she saw these abnormal labs on her lab work. Again, I'm referring to a call that I got earlier today about this. She reached out to her physician, and the doctor said, nothing to worry about. I'm not concerned about your elevated liver function tests. And I'm like, you know why they're not interested in it? Because most physicians, I'm not going to say everybody, most physicians and most healthcare now are only interested in disease treatment, not in disease prevention. So these elevated liver function tests are a big warning sign that, hey, something's not right. Because if they were fine and if there was no issue, they'd be within normal limits, right? There would not be flagging high if she was fine, but she's not. This person is also overweight. This person also drinks alcohol. This person probably has a bunch of other comorbidities along with this. So this little liver function, test labs is a red flag of, hey, something's going on. It's not to the point yet where she requires treatment, but is this a warning sign? Is this something where we can say, hey, maybe I should do something about this? Maybe I should tell her to change her diet. maybe I should tell her that she does need to lose weight because this liver is only going to progress. These liver tests are only going to progress and get worse. That's what we should be doing. But instead, we're just going to wait and wait and wait till it's like double red flagged and then throw some medication at somebody. That's what is going to happen. When there's such a better way. There's such a better way. Let's intervene now before it gets worse, right? Let's intervene now before she needs to be on medication, which is going to further damage her liver, right? Because this also shows, these liver function tests, the AST, it also shows damage from medications. So many prescription medications are damaging to your liver because, again, our liver filters out all of the medications, all the things in our body, all of our blood. So all of the pharmaceuticals that we ingest get filtered through our liver. So our livers become highly damaged from medications. And so many times in the ICU, where I worked for many years, we were monitoring liver functions on patients while they were getting medication, because there's a lot of antibiotics that we have to titrate based on the lab function tests. So if the lab function tests start to go out of whack, then we know we need to either cut back or stop on those antibiotics. So this is a red flag, very easy, red flag, a little warning sign to say, hey, we should probably start doing something now before this shit gets worse. So this is what I'm talking about like healthcare providers not communicating with their patients, with patients not understanding what their lab work is, not feeling empowered, not being educated. Why I'm out here making videos, sharing information about this kind of stuff, because this is all real life, real life stuff that's happening to people that we need to be aware of. So non-alcoholic fatty liver is something to be taken very seriously. It's something that is preventable, something that is reversible. Diet, exercise. I mean, legit, you have to lower your diet. You have to lower your weight. You have to change what you eat. You absolutely have to. And you can entirely reverse this non-alcoholic fatty liver. I have another client who lost a bunch of weight and now her liver is back to normal. A liver ultrasound, check. Good. Labs, check. All good. So that you can reverse it, you can fix it. But if you're not even aware that it's a problem right now, you're not going to do shit about it. And so obviously this provider is not communicating with her where she needs to intervene. So I sure did leave a message and say there's stuff that she can do right now to help reverse that and bring that number down back to normal. Okay. So share this video if it has been helpful, or if you know somebody else that will benefit from it. Please share this knowledge, because we need to be out here empowering ourselves and taking care of each other for sure. So if you ever have any questions, comments, suggestions about anything that I talked about in today's video, feel free to share. But again, non-alcoholic fatty liver, definitely reversible, definitely preventable, but you need to take action on it. Diet, exercise are number 1 and 2, or number 1 and 1. Like, you got to do those to change those. I see David says, thanks. Thank you, honey. I really appreciate it. Yeah. What else? That's all I have for today. So I just wanted to make this quick video and talk about that, but I'll be sure to make some more posts about it later. And Miss Vana says, thank you. I love your name. Thank you so much. Appreciate everybody tuning in. So that's all I have for today. And like I always say, for a balanced life, just add spice. I will see you guys mañana for the next video. Bye, guys.